This is a female patient admitted for coronary artery bypass grafting done with cardiopulmonary bypass support. She had history of hypertension and a chronic type B dissection. This is a transesophageal echo, 4-chamber view. You can see normal heart function, a little mild dilation probably of the left atrium. These are overgain images of, again, 4-chamber view, tricuspid valve and mitral valve, mild tricuspid regurgitation noted. This is the 2-chamber view. You see the left atrium and left ventricle, and no significant mitral regurgitation. And this is a 3-chamber view. You can see the left ventricular outflow tract and then the aortic valve with mild aortic insufficiency and eccentric jet on the right side image. A better view, a 3-chamber view. A red line notes a area that could be suggestive of a dissection flap, but this image was overgain. This is now a short axis view of the aortic valve. And now we have a short axis view of the ascending aorta. Note mild dilation of the ascending aorta and a fair amount of artifact images into it. This is a view of the descending thoracic aorta showing the type B chronic dissection flap and dilated descending thoracic aorta. The probe was advanced, and you could see the flap. And then a long axis view of the descending thoracic aorta with the flap, and the probe is rotated. You can see part of this chronic dissection. Probe deeper, you can see some elongation of the aorta, some calcification with shadowing posteriorly. And after standard heart cannulation and initiation of cardiopulmonary bypass, the following findings in the ascending aorta were noted on TEE. See a flap in the short axis view of the aortic root. The red arrows point to that, and then the yellow arrow points to an area of thickening of the left atrial wall, aortic root. This is a dissection flap that is noted. A short axis view of the aortic valve with the dissection flap going all the way down to the sinus of Valsalva. Again, the red arrows noting the dissection flaps. Also note in the middle of the image a flap moving in and out as a part of the flap tries to invaginate and the ascending aorta. So this patient had a cardiopulmonary bypass and a coronary bypass grafting, and on top of that required an ascending aortic and dissection repair.